The panel is the many faces of NFP. Now, there are talks going on. You had a choice. One advantage of coming here is there's opportunity for interaction more. Most of the keynote speakers are taking up the whole period, or there's too big a group. This is working, right? You hear me back there? Yeah. Or there's too big a group to have many questions. But this group, there'll be opportunity for questions. There are 3 of us panelists, and each of us will try to talk not more than about 10 minutes. So I'll give you the time to formulate your questions and ask them afterwards in a little more informal setting. When we say the many faces of NFP, I think Sheila chose that title. We're all working with the same goal, but we come from 3 different settings where we try to communicate the beauty of this teaching. We have Diane here representing a hospital setting, Dr. Delgado representing a medical office, and myself representing a parish. And each of us, each of you, are able to spread this beautiful truth, this beautiful message, this loving lifestyle in different ways in your own settings with the different people you encounter. So pleased to introduce, first of all, Diane Daly. She's a wife, a mother, and a grandmother. She's a registered nurse. She helped develop the Creighton Model Fertility Care Services and is director of the St. Louis Archdiocesan Office of Natural Family Planning and a faculty member of the Pope Paul VI Institute Education Program. She supervises the fertility care service at Mercy Hospital, St. Louis. So we're happy to have Diane here. I'm happy to present her to you to start us off.
Thank you, Father. It's great to be here on this very special anniversary of Humane Vitae that propels all of our work and our beliefs. So it's great that you've come to this. I'm happy to be able to share my experience at Mercy Hospital. My story started working with Dr. Hilders in 1976 at a St. Louis University Natural Family Planning program. It's a research program. And he moved on to Omaha, Nebraska, after about 14 or 15 months working in this research program at St. Louis University. So when he left the university, the archdiocese and the hospital in which we were based no longer wanted to support the program. So another nurse and myself approached the president of St. John's Mercy Medical Center, as it was called then, and we presented a very rudimentary presentation of the Creighton model system. And her name is Sister Mary Rockledge, and she said, this is something that a Catholic hospital should do. So she initiated the Department of what was then Natural Family Planning and has now become the Department of Fertility Care Services at Mercy Hospital in 1977. And we have been a freestanding department of the hospital since then, interacting with our goals and objectives, our budgets, and all the things that all the other mainstream departments of a hospital would do. And I think that's key because it gives us a tremendous credibility in the community as far as being able to provide this service within the medical setting. When we began, it was all about natural family planning. 85% of our couples were coming to space children. A few were coming to achieve, a few coming just for health reasons. But over the years, because we've been in this medical model, there has really been a shift to now many of the clients who come to us are dealing with infertility, dealing with medical issues. We have married couples. We have single women. We have teenagers with health issues. We have religious sisters and consecrated women who come into the program to track their signs in this very objective way with the Creighton model fertility care system so that they can receive the health care that they need in their gynecologic health. Because whether a woman is religious or consecrated or not, they may have the same issues as any other woman in terms of gynecologic health. And I love working with the sisters. They come maybe with PMS, premenstrual tension syndrome, and they'll say, I just pray harder for virtue to conquer this. And I'm like, that is terrific, but let's see if we can find out the underlying cause first and see if that'll help you be able to have this treated so you can be even more effective in your ministries and your apostolate. So we just started the program in 1977, and we're actually the first Creighton model fertility care service department in the world, actually. We were the first of those back in 1977. We are freestanding now about 1.5 miles north of the hospital. We have a suite of offices about 2,600 square feet. But we've had 11 different locations within the hospital and just about as many supervisors. And, you know, because I believe this is God's plan and His grace has kept us integrated within this healthcare system, every challenge that we have had, we have been able to overcome with His grace by help in the community, our help within the hospital, so that we could sustain our program. And I'm saying this to you because there may be people in the audience who would like to start a hospital-based program. And I do want to say that it is not always the easiest thing to do. There are challenges, there are opportunities. But I also believe that if it's meant to be, there will be the grace and opportunity to be able to make this happen. Our staff, well, first of all, we report to the Vice President for Mission within the hospital. And I think this is very important because we assist Mercy Hospital in their mission to the community by serving the underserved in this area of reproductive health. The founders of this hospital is Mother Macaulay. Our motto is excellent service based on the healing ministry of Jesus Christ. So this is a way to reach out to our community to be able to fulfill that mission in this very specific way in terms of reproductive health. Our staff includes an administrative assistant and then 3 office assistants. We have 5 fertility care practitioners who are working directly with the clients. We have 3 educators who also work with clients and assist in our education programs to train other practitioners. We have 1 licensed professional counselor who can assist our clients, especially our clients with infertility, who have so many struggles and are able to meet with this counselor. And we have a director of our Mercy Education Program. Every other year, we have a program in St. Louis to begin training practitioners to do this work. Our service includes the Creighton Model Fertility Care Service with an introductory session, followed by individual private follow-ups. And that is really the key to our journeying with every couple who comes to us. Those follow-ups are about 8 within a year or more if couples need them. They're standardized, begin with the more basic, and move to the more advanced. So our program begins with a group introductory session, and then the actual learning takes place in these individual follow-ups. We also broadened our service, so we provide parent-child sexuality education programs for mothers and daughters, for fathers and sons at age-appropriate levels, to assist parents in talking about sexuality and growing up in the context of respect for fertility. And we do about 6 or 7 of those a year. We have a full semester or partial semester program at Kenrick Glennon Seminary to assist our priests in understanding this work, and that comes out of our umbrella at Mercy Hospital. So we have about 13 hours of classes with them to teach these seminarians who will be ordained at the end of the semester, to teach them about naprotechnology, reproductive anatomy and physiology. What is Creighton Model? What are the tools available for you in your ministry and your apostolate to be able to help couples in this area? Because although they are totally on fire spiritually and in their vocation, many times they don't have the practical tools to know how to help people. So we provide that. We have the Mercy Education Program that I've mentioned. And I'd like to mention a very important part of our program that is part of our sustainability in this mission area, and that is our connection with the Archdiocese of St. Louis. Our Archbishop funds natural family planning at the amount, I don't think you'd be able to believe this, $200,000 a year for our natural family planning programs, our natural family planning office, our fertility care offices. And so that allows us to have a very active natural family planning office within the Archdiocese. And this office falls under the umbrella of, it's in the Curia, reportable to the Chancellor, but it assists in funding all the NFP initiatives within our Archdiocese. And it also supports the Department of Fertility Care Services, because with a specified grant, we are able to administer natural family planning in our diocese. We are able to provide a program called Enkindle for couples with infertility to give them support in individual counseling as well as group sessions. We have natural family planning parish ambassadors within the parishes to be an assistance to the pastor in this area. We have an adoption grant, the Archbishop Robert J. Carlson Adoption Grant, for the people who cannot fulfill their family desires through the service that we offer. About 20% of couples will not be able to achieve pregnancy. So we have an Archbishop's grant where we assist them in their adoptions and funding the adoptions. We just had our Humane Vitae annual Mass last Saturday for families with the Archbishop, and then a dinner afterwards, which was great fun for everybody. We have infertility masses. We have prayer services for them. We have grant distribution through our office, coordinating 40 teachers around our archdiocese in 20 different locations, representing 5 different models of natural family planning and about 70 volunteers who are assisting us. In almost every Catholic hospital in our diocese, we have a Creighton model program. And that's so important because the Creighton model fertility care system is a medical model, and it really is an allied health offering that works very well within the Catholic healthcare setting. Our funding involves, primary funding is through the Mercy Hospital and the Archdiocese of St. Louis. We have a budget for our program at just under $400,000. It is a very large program with many dimensions. We have that funded by private donors as well, our client fees, our grant awards from the annual Catholic Appeal, which is our fundraising arm of the Archdiocese, and also insurance reimbursement. Within our medical center, our own department, 86% of the charges are acted on by insurance, sometimes 100%, sometimes 50%. It varies quite a bit. Our clients are couples coming for family planning, coming for medical reasons, coming with infertility, or as I mentioned, even the religious consecrated women. In fiscal year 18, we served 770 clients with over close to 1,100 follow-ups. We provided 91 introductory sessions to 562 people, because within our diocese, natural family planning, our fertility care services, is required as part of marriage preparation. And we have maybe up to 16% and occasionally up to 50% of these engaged couples who come for an introductory session who actually enter the program to learn a natural system. And, you know, it's kind of tough, countercultural, because we all know many of the engaged couples are already cohabitating, already contracepting, but we plant seeds for them, and sometimes it's 2 years later we'll get the call where they will remember what they heard in their engaged program. In our hospital, the process for entering clients is by registering them as an outpatient, and they're registered into our electronic record system. Charges are made through our accounts payable. Insurance companies are billed through them, and then our clients are billed if the insurance does not cover that. We have private donors to assist also with those who do not have insurance coverage. Our expansion at Mercy Hospital that's going on now is to a 4-state region that Mercy serves, and our mission leaders, our senior vice presidents for mission of the 4 states, they are helping us so much in reaching out to our 42 hospitals in these 4 states so they too can implement these Creighton model programs. Until that's established, we are serving them through Mercy WebEx, which is a HIPAA-compliant electronic means of teaching them, where it's face-to-face teaching over the computer, and also a way to display their chart and tracking system and correct that. The final thing I want to say, and I know Doctor will say more about this, is we connect very strongly with our medical consultants in the community. We have OBGYN medical consultants who are specially trained in our subspecialty of naprotechnology, which Doctor will talk more about. But we do have a clinic in St. Louis that Mercy owns, and it is a naprotechnology clinic. It's probably pretty rare in the country to have this, but it's extremely successful. Our private OBGYN physicians within the Mercy system are referring to this doctor for their infertility clients, and they are expected not to refer outside of the hospital and not to refer for in vitro fertilization because we follow the ethical and religious directives. So they refer their infertility clients to this physician. He does NAPRA technology special education with them and treatments, medical, surgical. After they've had his treatment, and he was at a 65% effectiveness rate about 6 months ago with about a 3-month waiting list. And he then will send them back to their own referring physician for continued care. So it's a really great model that's working. It's increased referrals to our own department in a great way because Creighton Model Fertility Care System is the foundation for NAPRA technology, and the physician needs this in order to interpret the charts, diagnose, and then do treatments. So in conclusion, what I would like to say, in case others are pursuing having a fertility care system in a hospital, I would say these are the best practices for success. Work hard, really hard. Don't be discouraged. Have patience. It is not easy. It takes time to do all of this. Have perseverance. Take the risk. Do not ever be ashamed of the service you have to offer. It is moral and it is more effective than things that, as effective or more effective than anything else out there. Ask for assistance. Be a team. Find people in your community who can also support you. And it's been a tremendous privilege to be able to work in the hospital setting and to offer this service to so many clients.
Thank you, Diane. I'm sure many of you may be a little envious thinking about your own local hospitals or your own diocese you're in, but Diane has given us a good model of what we can do our part to work towards promoting this vision. Our second speaker is Dr. George Delgado. He's the founder of Abortion Pill Reversal and the medical director of the Culture of Life Family Healthcare. He's published several articles in peer-reviewed medical journals, including one this past April. He's board certified in family medicine and in hospice and palliative medicine and an NFP medical consultant trained in NAPRO technology. So we'll hear his work presented to us in the medical practice setting.
Good morning, everybody. So I want to tell you a little bit about our medical office that we have and what we do and how we're structured, just to give you an idea of our perspective in a medical office. So we're called Culture of Life Family Services, and we kind of have two arms. We have the medical arm, which is called Culture of Life Family Healthcare, and then the ministry arm, which is called Culture of Life Family Services. And the two work hand in glove in order to further the mission, which is to improve the physical, emotional, and spiritual health of the community, and specifically by promoting the gospel of life. We have two physicians and a physician assistant. Both of the physicians, Dr. Karen Soroki and I, as Father said, are NAPRO technology trained, and everything we do and offer in the practice is in full accord with Catholic Church teaching. We have a full medical practice that treats newborns to adults, and we also do prenatal care. And then the NAPRO technology is part of the practice. We're going to talk about that a little bit, and the natural family planning we'll talk about in a minute also. The rest of the Culture of Life Family Services, they are there to help women who are in crisis pregnancies, women who are considering or being pressured to have abortions, or also to help women who've taken mifepristone, the abortion pill, and choose to reverse that. And that's something obvious that we offer since we started it. The ministry side also does a great deal more than that. There's a lot of outreach and classes, parenting classes, and we're going to look forward to trying to start breastfeeding classes. And we're looking in our plans to start a men's program, because what we've seen both in our neck of the woods and nationally is that unless you engage the men, it's going to be very difficult to stop this cycle of unplanned crisis pregnancies and then either near abortions or abortions. Very difficult unless you get the men to get engaged and to stand up and to be men, and instead of being predators, to be protectors. And that's really a key message we want to give to the men out there, of course. So the other outreach is that we go out and to the high schools and to the colleges, and we start pro-life clubs. So I think we've started pro-life clubs in about 5 different on 5 different campuses, and we've engaged the youth there so that we can really get them thinking about why pro-life is so important and why it's something to think about when they're young. And the young people these days, if you may have noticed, they're kind of they're pro-life sort of at the core. They kind of get it. Not like my culture or my generation where we kind of had to be convinced. They kind of get it from the start. What they don't get, of course, is the whole gender thing and the marriage thing, where marriage is between men and women. So they need work there. But as far as protecting life, a lot of them are really with us already. So that's really encouraging to see that. We have a mission statement, because what we've discovered early on is that it's not good for people to come to our office as regular patients, which most of them do. They come because we're on their insurance list. It's for them to come in and, "Hi, doctor, I'm here because I want you to refer my birth control pill." I go, "Oh, well, I can't refill your birth control pill." And then they get really upset. So we don't want to make people upset. We want to draw people in and we want to engage them, but we don't want false pretenses. So we have a mission statement that we give out as soon as they think they're going to come to our office. And the mission statement pretty much says what we do and what we don't do. And I think it's a very beautiful mission statement. It pretty much says that we honor the gift of life and that we follow traditional Christian teachings, which Catholic teachings are the traditional Christian teachings. This is in 1930. Some of the Protestant denominations went off course and others followed, unfortunately. But way before that, no one accepted contraception. And we say that we honor life, but we also, and we say we don't prescribe contraception, we don't refer for abortion, we don't refer for euthanasia, we don't prescribe erectile medications or we only prescribe erectile medicines for men who are married to women. Unfortunately, we have to say that in California. And then we tell them that we do offer very effective natural family planning services, fertility care services, so that it's not just that we're saying, no, we don't provide contraception. We're saying, we don't provide contraception. The reason we don't is because we don't think it's good for you, and we have something that's much better. So that's kind of the tact. And when I meet with patients, sometimes they come in and they know we don't prescribe birth control pills. They ask for a referral or something. And I say, well, I really can't make that referral in good conscience because I don't think that's the best thing for you. And let me tell you why. And the way I tell them depends on where they are, what journey they are in life. So if it's somebody who, and I always do a religious history as part of what we call the social history. So, we're supposed to ask, do you smoke, do you drink, do you use drugs, are you sexually active, what's your occupation, all this, blah, blah, blah. But most of the time, doctors don't ask, what's your religious preference? So we make it a point to ask that because really, if you think about it, there's really nothing more important about the social history, about how the person fits into a group as to what their religious beliefs are. So I've tried very many different things. I used to ask, what's your religion? And they would say, I'm Catholic, I'm Protestant, I'm Jewish, or whatever. Now when I say, what's your religion? They kind of look at me like, huh? Because what are people saying now? I'm not religious, I'm spiritual, right? So, gosh, what the heck does that mean? What does it mean? When they say they're spiritual, that means I'm choosing to create my own God. But I don't tell them that, of course. But usually I started off, I say, do you have a religious preference? So they say yes, and I say, okay, what is that? Whatever. And they'll tell me. Or, no, I don't have a religious preference. I say, okay, well, do you have any beliefs? They say, and they kind of don't really give me an answer. I say, do you believe in God? And they say, yeah. Or do you believe in a higher power? Finally, I narrow it down. And most of these people have some belief in God. They just don't want to define that belief because they don't want to be pinned into any kind of construct that will limit what they can do, right? But we figure out what they believe. And so if they are Catholic, then of course I hit them with the Catholic route. And I say, hey, do you know that the Catholic Church doesn't approve of contraception? And do you know why? I say, no, I don't know why. Now, usually they have some idea that it's not the right thing to do. And then I explain to them the teachings of Humane Vitae and all of those beautiful things that we don't have time to go through right now. Then, if they're not Catholic but they're Protestant, then I talk about God's design and what the Bible says about the beauty of children and about the sin of Onan in Genesis. So I hit them with the Bible because that's what they're used to being hit with, right? Then if they are not Christian, but let's say they're Jewish or Muslim, then of course I'm not an expert on those, and I know they have very many varying teachings, although I know that Muslims are usually against abortion. They'll ask me, what does your faith teach you about contraception? And I kind of get a little more information, and then I try to follow that path. If they don't have any really religious beliefs, then I go the natural law path. And I say, well, do you think this is really the best thing for you? What do you think that sex is for? And usually we can kind of come to some agreement that maybe it's for marriage, or at least that's the ideal. And then I say, okay, well, when you look at sex between husband and wife, isn't it a total self-giving of one for the other? And isn't that what marriage is all about? So when you're taking these contraceptives, aren't you somehow not giving yourself totally to your partner? Then if they're not going for that, then I go to the medical and the physical things. And there are plenty of them. So I said, well, do you know that if you take birth control pills before your first term pregnancy, you're going to greatly increase your risk of breast cancer? And that kind of catches them because everybody knows there's an epidemic of breast cancer, right? Or I say, you're on these contraceptives and your boyfriend and you are having sex. What if you said, I don't want to have sex because I want to wait till I'm married? What do you think he would do? And they know what he would do. He would walk away, right? So I tell them, well, does he really love you for who and what you are, or does he just want your body? And sometimes I get some people that way. Or sometimes I go through all this and they still want birth control pills, and I say, well, I can't stop you and I respect your free will and your autonomy, and I do, but in good conscience I can't refer you, but I can help you with anything else you want, and if you ever change your mind, we're here to offer you natural family planning. So I try to engage them, keep them with us, keep them on the course. And I think that's very, very important. And by the way, if they have an IUD, I say, if you're tired of that IUD, I can take it out. I won't put it back in, but I will take it out, so we'd be happy to take it out. Or if you have the implant-on, the little insert they get in the inner arm, if the side effects of that are no good and you want to take it out, I take it out. I'm very good at taking it out, and we'd be happy to do that for you. So I give them all the options that we do and tell them what we can't do. And I think that's just being honest with them. And that way we are never accused of being deceptive or deceitful with our patients. As far as the NAPRO technology part, so we have two parts. So we have the natural family planning, those who maybe don't want to conceive right now. For them, I tell them that all natural family planning models are really the same in my lab for family planning. So we have a whole host of them. The diocesan office gives them a whole list of different ones. We, of course, focus on the Creighton model because it's medically modified, so it's the platform, it's the roadmap for NAPRO technology. We offer the medical NAPRO technology in our office, that is everything except for surgery, so we do the full evaluation, do comprehensive hormone panels, order all the tests, do follicular ultrasound series if needed, and then implement treatments as necessary. If we think they need surgery, then we have a great NAPRO technology surgeon in our county, just about a half an hour up the road. We can send them there for any kind of surgical procedure that they might need, and then we can follow up afterwards, or they continue to follow up with that surgeon. So I think we're about time for questions.
Can I speak?
Oh, before I speak.
Can I speak before the question? Yeah. Thank you, Dr. Delgado. We certainly need such medical practices everywhere. I just think the Catholic Church, how we founded great institutions, universities and hospitals to further our mission, and how many of those institutions are not so faithful in furthering the mission. We really need medical offices and practices that will stand up against the current medical practice of so many unnatural things. For my part, to speak from a parish setting, if you're Catholic, you belong to a parish. And basically, I've got three areas, what needs to be done in parishes. First of all, we need to prepare natural family planning teachers. Secondly, we need to educate our parishioners. Thirdly, we need to provide people spiritual and devotional support. To speak about preparing teachers, we have invested. I'm from a quite poor parish. Our budget is very strained. We do not have a paid youth minister or paid choir or any of those things. But we invested in at least the training for natural family planning, and we had 9 couples who were certified to teach. 6 of them are still teaching in our parish, and 1 of them teaching in another parish. Training, we got through 1 couple through Family of the Americas, 7 couples through the Couple to Couple League, and we have 2 that are halfway through their Creighton certification right now. So investment needs to be made because this is fundamental for community, supporting families, married couples, and children. Education, the second element, providing a method alone and saying, well, here's an alternative to birth control, you go to them and take the classes, doesn't take care of everything. People's minds and hearts, support, spiritual motivation, understanding is needed. We have a weekend, we call it La Familia Natural Vive Mejor in Spanish, we call it Life-Giving Love in English. In 2 days, all day Saturday and Sunday, couples and the priest present the building blocks, I call them, step by step. We don't even on Saturday, we don't talk much about contraception or natural family planning, but we talk about the purpose of marriage, the twofold inseparable purpose, God's plan for family and children. We present a talk about the world's plan, the way world is thinking in contrast to that. Then we talk about, the couples share personally on sexual intimacy as giving, different than using, and communication in marriage, but communication in the areas of sexual intimacy, co-responsibility and planning family, and intimacy during times of needing to abstain from sex. And then on Sunday we go into the following talks about the how many children a couple is called to have, what are legitimate means for postponing pregnancy, and insufficient means. And then what are moral methods and immoral methods. And then we talk about the damage done by contraception at all the different levels and the benefits of natural family planning and where people can learn it. We require that. We invite all married couples can come, or dating couples, or anybody can come actually, but we require it for those preparing for marriage, even if they've already been cohabiting or married civilly. The education also for our youth, theology of the body youth retreats, the youth themselves put those on a weekend. They sleep in the gym or classrooms on the floor, and they have a weekly meeting for that. Naturally, priests from the pulpit and in confessional are called to teach this. Or in counseling couples, people coming, what's wrong with their marriage? I say, well, let me get a little history first. How did you meet? How soon did you start having relations? What about your openness to children, contraception, and sterilization, and all those issues come up? Did you ever think this might be related to the problems you're having now, and how selfishness is introduced in so many ways we don't realize, and God is excluded? Also, when I talk about pulpit and confessional, also letting people know, did you know priests are not authorized, we're not authorized to give you permission to commit sin? We're really not. We don't have that authority. I'll give you an example. If your spouse is bored with you sexually and finds somebody else, and he asks his pastor, and the pastor says, oh, go ahead, you can have relations with that other person, what would you say about the priest? Say, he can't do that, and neither can we permit abortion or contraception or sterilization or in vitro fertilization. The third part, devotionally, spiritually, we have begun a devotion. It's called the Holy Spouses Rosary. There's a little booth there, not one of the flashy booths, but one of the simple, poor booths there. But we have materials available for you, recorded and written on the Holy Spouses Rosary. This is a devotion to include St. Joseph in the joyful mysteries, which are extended actually to 10 mysteries of the Incarnation and Hidden Life, and the Hail Mary version extended to include St. Joseph. The doctor said about the need for men. If we don't have a vision of manhood and man's role, a woman has great difficulty in living her role as a wife and a mother. And so Mary and Joseph are the universal models. We don't see them enough as husband and wife, though they're virginal spouses. That's because of the incarnation of the Son of God by the Holy Spirit to them. And so they do not procreate in the normal way, but they love each other no less. They love each other through their abstinence model for at least periodic abstinence, as well as married love, a model of no selfishness involved in the relationship. We have a society of the holy spouses for those who would like to make an eightfold commitment, and there's an enrollment. We have a little book there called, it's a bilingual book, Family Starts with Marriage. I think it's $9. I encourage you to get that book that tells about these ministries. There's a little right there for enthroning an image of the holy spouses, Mary and Joseph, and we have the images there, enthroning it in the home. And there's also liturgical feast of the holy spouses that's in particular calendars. I think it should be in the universal calendar. Steps to that are included in that book, how you could start the devotion and maybe get your diocese to establish that liturgical feast. So that's a brief, quick summary of what we do at Guadalupe Parish, also St. Joachim's Parish in Madera. We're Oblates of St. Joseph, who do these ministries in the Diocese of Fresno. And so we will open it now for questions. You can address, so we'd ask you to come to the microphone and line up. You can address your question to any one of us, particularly Mrs. Diane Daly, Dr. George Delgado, or myself, Father Larry, or you can just throw up a general question for any of us who feel like answering it if we want to, okay? Please come to the microphone, yeah.
Dr. Delgado, when you refer patients who need surgery, is it Dr. Teresa Stegan that you refer them to?
Yes.
What is the difference between NAPRO technology and the Billings method?
The difference, did you say?
You meant the Creighton?
Oh, yeah, I'm sorry. Yeah, Creighton. Yeah,
Oh, the
I
difference
only know
between
really about the Billings method. That's what
difference
my husband
between
and I
Creighton
use.
model and Billings method.
Yeah, I
Okay,
don't know
thank
what
you.
the difference is.
Just briefly, there's probably a lot to say about that, but the Creighton model system was based on the Billings ovulation method. But in the early years of our research, we found our need for standardization for terminology, client education, teacher education, and through that standardization, it allowed more research to be done in the way that we had hoped to do it. And so because of the standardization, it opened this whole field of NAPRO technology, the medical portion. Creighton model system is a one-on-one follow-up with people. That's the hub of what we do with a standardized approach. The Billings ovulation method would be maybe, well, in our own diocese at least, there's a group session and then maybe a handful of follow-ups depending if people need them. Creighton model will not even give materials without follow-up. It's so key to the use. So that's one big difference. The individual journeying with the client, it's our view with the Creighton model that we will journey every step of the way with the client individually as long as we can with a personal relationship. And I think on the billing side, they also will journey with the client, but it's more dependent on the client contacting them. So that's kind of my understanding.
But it has the same basis. It has the same basis of how to do it, the charting and.
The charting's very different. Creighton model uses a vaginal discharge recording system. It's a universal language used on 6 continents. It's a system of numbers and letters that represent the observations the woman sees. On the other hand, with Billings, it's women tell them what they see in their own words. So that would be a big difference in the charting. The stamp system's the same, the philosophy's the same, but the approach to it, it's very different. The teacher training's very different, a 13-month education program with an on-site visit for the Creighton model and so on. I do have a handout up here, and anybody is welcome to have it. It explains the Creighton model system and all the variations of the, I guess, the infrastructure and what it represents. Does that kind of answer? I know it's a it's a hard question. I think one of the Billings teachers just mentioned they have 2 follow-ups for 20 minutes. We have 8 within a year, the first an hour and a half and an hour every follow-up. So probably the intensity is a little different.
Father, excuse me. I'll address this question to you. I'd like to know, me and my fiance are here. We'll be getting married next year, and
Congratulations.
thank you. And I guess my question is, are there any abuses to the use of NFP that you've seen as a pastor spiritually?
Certainly anything can be abused, and I think it's important you're getting married. My personal approach has been to tell couples, are you ready to have children? If you're not ready to have children, you have to consider whether you're ready to get married or not. I don't advise couples to start out with the idea of avoiding or postponing pregnancy for long periods of time. And why would that be? Well, first of all, you don't know how fertile you are. And fertility is already starting to diminish for the woman after 25. Secondly, this is intimately linked to the purpose of your marriage. You don't have to get married now if you're not ready to have children. You can wait until you are ready. Thirdly, just on a practical level, our lives are so busy and so full, and we live together several years, and you know, we get used to not having children. A baby comes along, and it can seem like a bother more than part of our marriage. Now, the baby will help overcome that. You can grow out of that, but that's one danger. Another danger is just having a contraceptive mentality that, well, we'll use this. It's supposed to work like contraceptive. No pregnancy should result, and, you know, this should be absolutely according to our will, which the bottom line is it's always God has the last word. You know, we study the science and try to apply it the best we can, but we're not infallible. And of course, another danger is thinking that, you know, just still being selfish and not being more open to life, not having a good reason to postpone pregnancy after, or using it just, we decide beforehand we're going to have 2 children, 3 children, and we're going to be done, and we'll use NFP the rest of our lives without having a sufficient reason for that.
And then
one more danger with it, of course, is not knowing how to love during abstinence. That has to be learned, and a chaste courtship will prepare you for that. But an unchaste courtship won't prepare you for that. And so that'll be dangerous, and it could be cold and distance you from each other.
Okay. And then one more question. I know Miss Diane mentioned about spacing children, and what is the church's stance as far as spacing children?
Well, the church's stance is that husband and wife, you're responsible together in conscience. So between God, you decide together, you know, what is best for us to give attention to the child we have, and what is best for the child and ourselves. There's no rule that, you know, that you can't space. Spacing can be responsible. We often in our workshop, we often recommend, breastfeeding. What do we call it? Ecological or something. Ecological breastfeeding on demand. In other words, that helps naturally space children a little itself, but there's nothing immoral about spacing. It depends how long the space is going to be and what's the reason for it. Okay.
Okay. Thank you, Father.
Yeah, bless you.
I was at a pro-life event and met a woman who's an RN who's a part of a... So I was at a pro-life event and met a woman who was a part of an emergency response team where women who've taken the abortion pill, she started telling me about you, and that this technology exists, that somebody had created it, and that there were certain facilities that were trained on your methods, that there were certain places that were certified to administer the treatment regime for these people. And my daughters were kind of like elbowing me, hey, you need to get involved with this ministry and try to hook up with them. So I have a couple questions. I know that this conference is really geared and about contraception, or conception. But what about, it made me realize talking to her that so women go to Planned Parenthood, and when they decide to keep the baby, then the door's closed, and then what? So I feel like there's just a lack of knowledge overall. Where do you go next? It seems like there are facilities that are federal, that exist, that I didn't know about, that are just everywhere, that women can go and receive support for keeping the baby. Now, what about also...
just to clarify, are you asking support for women who decide against abortion?
Right.
But you mentioned did
There-
you mention
yeah.
abortion pill, though?
Well, there's seems to be a lack of awareness on so many places. Like
Right.
if there are federal healthcare facilities that can take people who want to keep the baby, do those facilities have NFP? Like, is there a way to get NFP so mainstreamed that the government is a part of administering this knowledge into the general population
Okay.
through
I think
federal
I
healthcare
think
facilities?
I think you've given us enough to answer somewhat. I
Yeah.
understand you've got a longer conversation, but we'll give
Yeah,
other questioners a chance.
yeah.
Just to say, government is not very helpful. Government has been very involved politically in the abortion industry, at least, the last 8 years, previous 8 years for sure. But also the funds and everything are so tied up with contraception, and that any government program is not going to be exclusively, like doctors talking about a medical practice that is exclusively pro-life. You're not going to find it in anything sponsored by the government. There are many pregnancy care centers. There are many, when abortion was legalized back in '73, right away, Birthright International started for that, to give support to women and help them have their babies. But they get very little funding. They're mostly private initiatives, local rights to life and that, or parishes, dioceses will support them. I thought you were asking about the abortion. Those who have taken the abortion, doctor has been influential in trying to reverse the abortion pill.
I'm trying to think of how can we get your technology more mainstreamed, and how
Well,
can we
we'd
get NFP more mainstreamed.
Yeah, that's what we're all here for and working at. But, requires conversion of minds and hearts to get, and we continue, with laws and this and politics, who we vote for and all that. We continue to try and influence the culture and the society and the government. But we probably have to start at a much more local and personal level, and that become the mainstream.
I would just add that all of us as individuals need to look at what our gifts are and what our spheres of influence are. Your sphere of influence may just be with your family, or it may be with a greater group of friends, it may be with community involvement, it may be with government. So find out what your sphere of influence is and start to influence that sphere in a charitable but always accurate way, so that no one can accuse you of being fake news. And through that, I think that's how we'll convert the culture, each individual sphere of influence, and it'll be a huge ripple effect. And some people will have a sphere of influence with the government. Well, don't trust the government to make things right for us, but they sometimes can be part of the solution.
I would just like to add one other comment in terms of natural family planning or fertility care within these centers that are trying to help women. And I'm aware that there is more of a national movement now in the private sector to have counseling for women who have chosen to maintain their pregnancy, maybe keeping their babies or maybe placing for adoption. But fertility care is getting integrated into some of those centers, and so are other forms of natural family planning. So I think there is a move towards this. The only one I can think of right now is called Guiding Star, but there are some others. I know there's at least one other nationally that you could kind of Google for yourself.
Hi, I'm Suzanne Regal. I'm an obstetrician gynecologist who's retired. And in San Jose, the Daughters of Charity had this wonderful idea that they would start the Center for Life so that anyone who wanted to have OBGYN care, regardless of their income, could have service. And they hired me and 2 other male OBGYNs, and we functioned exceedingly well because we had a team of 3 NFP Creighton teachers, 2 of whom were bilingual, so there were new English and Spanish NFP classes being started every single month. And then after the introductory session, they were all followed privately, just like you mentioned. And they also supported me to become a medical consultant and a practitioner in the Creighton method. And that all functioned beautifully from 1976 until 1999. I retired, and what happened was they had a form of medical underwriting by the government called Medi-Cal, who would pay a certain amount for people who couldn't afford medical insurance. And at that time, during the time that we were all functioning so well, when you would send in your bills for your codes for your the medical work you did, they paid you a smaller amount because you were not owning the facility, and they paid the facility a certain amount for, the nurses and other things that they hired and ran. And starting in 1999, they said they would not do that anymore. So the whole thing closed down, and it's, to me, tragic. And I would like to hear from Diane and Dr. Delgado how you financially are. You said you did have somebody who provided medical care, I believe, and how are they in their own office? Because the Daughters of Charity were now in such bad financial shape, and also decimated, so many, nuns leaving the order and everything, that they have sold the hospital where we were. Thank you.
In terms of the people who cannot pay for the service and getting NAPRO technology care, I think our Archdiocese has been extremely generous to us with this grant that I mentioned. So we use grant money to teach people who cannot afford to pay fertility care services. No one's turned away because of an inability to meet the cost. In terms of our physicians, different physicians have different policies depending on maybe their overall structure in terms of their charges or who they're themselves reporting to when they're hospital owned. But within our hospital, we have a JFK, John F. Kennedy clinic, and if any clinic patient needs NAPRO technology, we have 2 doctors who can provide that, one specifically for infertility and NAPRO technology surgical techniques, and the other one who provides medical NAPRO technology. So that would be an example in our own setting. There's also a clinic, particularly for the Hispanic community, connected with our Catholic University, St. Louis University. And we haven't been able to actually get fertility care into that clinic, but we have been able to open a fertility care center on campus of St. Louis University. So the younger people are some of the people who are of the Hispanic culture are able to go to these centers also. But our policies, we don't turn anybody away. When you get into the medical treatments, it does, I believe, get a little more complicated depending on the doctor. I think in terms of surviving with our work, it's really dependent on having others who will help us. So I've learned over the years that there are people of influence in the community who will help us with grants, and they will fund maybe 6 people a year who need this service. And I think sometimes we're reticent to reach out to those people. And yet my experience has been they're very happy to assist because they believe in what we're doing and they don't know what vehicle they have for assistance. So that's one other way, somebody in the community who could actually fund a particular unit of care, so to speak.
First, it's an honor to have Dr. Burgell here. She has a great reputation that precedes her. She's much loved in the San Jose area. I've known about you for years, so it's an honor to be in the same session with you. What we do is we have our medical practice is separate organizationally from the ministry part, and both of us barely make it as far as staying in the black. We get most of our income by billing for patient visits. When we have someone who absolutely can't pay, then we have, we call them mission patients, and then the ministry side then reimburses the medical side for those services. As far as for the natural family planning part, we work closely with Creighton model practitioners who make their own arrangements for people who can't afford, and for people who can't work it out that way, then usually, unless they absolutely need NAPRO technology, they'll go with the billings method or with the couple-to-couple, which is a little bit more economical.
We have just a few minutes before the lunch break, so maybe you can have brief questions.
Yeah, I'm Geraldine from Singapore. My question will be very specific and to the point.
Did you come from Singapore just for this conference?
Yes,
Wow,
and my
welcome.
husband is with NAPRO Technology, yesterday. So this is the question I'm posing. It actually happened. So please help us. What if your client, your patient comes to you and very proudly says that she is practicing NFP with her boyfriend? So how do you handle it tactfully and professionally?
Well, that definitely comes up, and sometimes it comes up when they want to learn NFP and they're not married. And so our philosophy, which I think is shared by the Creighton organization, but Diane can comment on that more, is that we never condone immoral behavior, and we will tell them that we think that they should be abstinent until marriage. I tell them that very clearly. On the other hand, I think that teaching them natural family planning actually helps contribute to chastity, because then they learn about the beauty of the reproductive system, how it's a gift from God, and how it's really meant for marriage. And we work with, when we make the referral to our NFP teachers, I tell them that, and I tell them what the situation is, and they usually are comfortable with that.
I agree with you on that.
Sorry, just reminder that it's professional situation. So talking about God may not be appropriate.
No, it's appropriate to talk about God in a professional situation if that patient is willing to accept talking about God. And that's the unfortunate thing, is God has been pushed out of the public square and out of the exam room, and so we try to fight that. But if the person does not have an orientation towards God, then I don't mention God. I just say, we don't think that having sex outside of marriage is the best thing for you, because it does not follow the natural design. And I think that's the appropriate professional way to frame it.
A brief answer is just with the Creighton model system, the first instruction at the introductory session is for a couple to avoid genital contact for 2 weeks. At that next follow-up, it's recommended 2 more weeks. So for the couples who are in this type of situation, nobody prefers that, but we do believe it's a form of evangelization to continue to teach them. We always recommend that they avoid genital contact, always, until their marriage. However, it's very interesting, because once they've avoided genital contact for 2 weeks, they come back, the teacher supports them. 4 weeks, they come back, the teacher supports them. What we say is, well, now you've avoided genital contact for 1 month. What's it been like? And the woman's like, oh, it's been kind of nice. he kind of is paying more attention to me. Things are a little different. And he's kind of like, well, I guess it's been okay. That's what we hear. Okay, so then we say, well, what would you think about avoiding genital contact for the next 2 weeks until you come back here? And then most of the time, in my experience, people say, okay, you know, we can do that. And then we eventually, now we've got a relationship going and we're able to say, well, how about just avoiding genital contact until your wedding? What a beautiful wedding gift this would be to one another, to then consummate your union again on your actual wedding. And you know, nobody talks to people like that. I mean, Father probably does, but in our area, we don't hear many people talking like that. So we challenge them. We very rarely, I can't even think of a time we've had to turn someone away where we can no longer teach them. And if they do continue to be genitally active, every practitioner has to make that decision for herself. She doesn't want to be cooperative with that. Can she continue to teach the method and still challenge them towards chastity? And that's what we try to do and to encourage.
Thank you very much.
This question is for Father. I run a youth group, and I would love to do the youth retreat that you say, and I would like to know if you have a book or resources for me to know what topics to teach.
Well, we didn't invent the resources. I think it's Ascension Press has Theology of the Body for Teens.
Okay.
Where are you?
In Hesperia, California.
Hesperia. We've had other parishes come and come with a youth minister, and 5 or 6 youth attend our retreat and then go back home and do their own. So you'd be welcome to do that. We'd be happy to have you there.
Oh, okay, thank you. When is your next retreat?
If you go to the Holy Spouses booth, somebody there might know. They might not, but at least you'll find our contact information
Holy
to
Spouse.
find out. Yeah.
Okay, sounds good. Thank you.
I think we just had our 2 retreats, and it'll be a few months now.
I just wanted to say that I know that there are theology of the body for teens in our display booth.
That's right. Some of the display booths here will have those materials right here. Yeah.
I'm a fertility care practitioner in Atlanta, and we don't have a lot of support there. I was wondering if there's any specific things that I can bring to my pastor. You know, he's very, it seems like he's anti-NFP, maybe anti-Creighton model, because we're asking for, payment for our services. So.
Yeah, it's pretty common in Atlanta. You're more of a minority as Catholics there too. All I can say, how do you convert a pastor's heart like you convert anybody else's heart? You know, it's the witness of couples telling a priest, maybe especially couples, we used contraception and we found out this was damaging us, and we found something that's really enriched our relationship. That's probably the best way. I don't know your pastor, but it's one of the best ways to his heart. If the money isn't there and the funding isn't offered, got to look in the community, other ways, who will be benefactors, who will support. But it's a fight we've been waging these 50 years. So there's progress in other places. There can be progress in Atlanta too. Don't give up.
Okay, thank you.
There also is, you may want to contact Anna Saucier. She gave a talk, so she's worked out the business parts of fertility care.
Just one more encouraging news. We may have some more access to lots of different types of natural family planning teachers through a company called My Catholic Doctor. They're going to open their doors on September 1st, and it's a telehealth medicine company, and we're actually looking for NFP teachers to help us out to do this as a telehealth medicine offering to work with couples all over the country. And so that may be an encouraging way to reach those places that don't have a lot of opportunity. Well, the company's founders are going to be based in Connecticut, but we are actually working all over the country. So, yeah, it's called My Catholic Doctor, so you can Google it. And we have a booth.
Okay, so I don't have a question. I just have a comment. I'm from St. Joachim's in Madera with the Oblates. Father Larry used to be there, and he started the, I'm shaky because I'm nervous. He started the theology of the body retreat like 12 years ago maybe or so. So we're still doing the retreats. We have 4 a year, 2 in Spanish, 2 in English. So if you guys can get this started in your parishes, go for it, do it. It's a blessing. It's a true blessing for the whole community, for families, for teenagers. It'll affect them in the long run. And I also work at the tribunal office at the Diocese of Fresno, so I see the effects of theology of the body not being implemented in the marriages. So I'm like on both aspects. I'm over here with the kids teaching them, and then I'm over here at work dealing with the effects of it not being in that courtship, in the marriage. So, yeah.
Speaking of tribunal, at the clergy conference yesterday among the priests, one of us said, well, if everybody used natural family planning, all those priests spending all their time in the tribunal could go work in their parishes. Okay.
Good afternoon. My name is Nidia Correa. I'm from El Paso, Texas, with a Guiding Star. We were, I believe, the 6th affiliates to start with Guiding Star, the model you were talking about. So we were of pregnancy medical center, and when I found out about Guiding Star, it's to help pregnancy center go into the model of being fully medical to support not only obviously NFP, which we're already doing, NFP teachings, but to bring in a doctor or a nurse practitioner to support well women care and then beyond. So we really feel like that's the answer to how we're trying to even address the abortion issue, because we have to get back to basic family values, right, and supporting that family unit. So I do, if anybody's here from a pregnancy center or is with a city that might be looking to do this, because I really do believe I have a couple magazines I can give away. I'd be happy to give my number in regards to that. So you can talk to me about it in questions. And very quickly, I do want to give some information on Solidarity Health. I don't know if you all have heard of that, but it's a new healthcare plan that's a Catholic care plan, and they actually they just announced on the 25th for the anniversary of Humane Vitae, they have decided now to cover reversals of sterilization and a couple of other things that before they couldn't cover. So
I'm sorry, but we're about almost 10 minutes overdue for lunch, and there's big lines for me out there, and we're at the ends of the line. So thank you all for participating with us. Yeah.